Imagine waking up 2,000 years ago with pain so unbearable you can barely breathe. You somehow find the best doctor after covering hundreds of miles. He examines you, thinks for a moment, and says, "I can help." You sigh with relief. Then his assistant walks in, carrying a saw. No anesthesia, no antibiotics, no sterile operating room, just a few people holding you down while the doctor tries to save your life. Welcome to ancient medicine, where surviving the treatment was sometimes harder than surviving the disease. Number 1. A hole in your skull. Let's begin with your head. For thousands of years, surgeons performed a procedure called trepanation. The idea was surprisingly simple. Cut or scrape a hole straight through someone's skull. Why? Sometimes to relieve pressure after a head injury. Sometimes to treat seizures. Sometimes because they believed evil spirits were trapped inside. No MRI, no CT scan, just experience and hope. The surgeon would carefully scrape through the skull, millimeter by millimeter. One mistake could be fatal, yet somehow, many patients actually survived. Scientists have discovered ancient skulls with smooth and healed edges, meaning these people didn't just survive the operation, they lived for years afterward. Imagine meeting someone who literally had a hole in their skull and was perfectly fine. Number 2. When limbs had to go. Now imagine you're working or fighting when disaster strikes. Your leg is crushed. Your arm is shattered. Today, surgeons might rebuild it. Back then, there was only one realistic option: amputation. The surgeons didn't have modern medicines. They had a sharp knife, a bone saw, and speed. Because speed was everything. The longer the operation lasted, the greater your chances of dying. Several people would pin you to a table. Others placed leather between your teeth, not to ease the pain, just to stop you from biting through your tongue. The surgeon cut through skin, then muscle, then sawed through bone, as quickly as humanly possible. If everything went perfectly, you might survive. If it didn't, blood loss or infection would finish the job. Number 3. Fighting fire with fire. Sometimes a wound wouldn't stop bleeding. Ancient doctors had a terrifying solution. Heat a metal rod until it glowed bright orange. Then press it directly onto the wound. The smell, the sound, the pain, well, it's almost impossible to imagine. But surprisingly, it often worked. The intense heat sealed blood vessels and sometimes reduced the risk of infection. It wasn't pleasant, it wasn't gentle, but if the alternative was bleeding to death, many patients accepted it, whether they wanted to or not. Number 4. The stone from hell. Few medical problems were more feared than bladder stones. Imagine every time you tried to urinate, it felt like broken glass. The pain never stopped. Eventually, you couldn't ignore it. You found a surgeon. He had one solution: cut you open. Ancient lithotomy involved an incision right between the legs to reach the stone. No anesthesia, no pain relief, just assistants holding you still while the surgeon worked as fast as possible. Some stones were the size of chicken eggs. Removing them was only half the battle. Surviving afterward was the other half. Number 5. Your eyes aren't safe either. Now imagine you're getting older. The world is becoming blurry. You have cataracts. Today, a tiny operation can restore vision. Ancient medicine had another idea. Take a sharp needle, push it into the eye, then force the cloudy lens out of your line of sight. This procedure was called couching. Sometimes patients could see a little better. Sometimes they became completely blind. Either way, letting someone stick a needle into your eye while you're awake wasn't exactly reassuring. Number 6. The dentist you never wanted. People often think tooth pain is a modern problem. No, it isn't. Humans have suffered from rotten teeth for thousands of years. Ancient dentists had no drills, no numbing injections, no comfortable chairs. Usually, the answer was simple: pull and pull hard. Using metal tools or forceps, the tooth was yanked free, hopefully. Sometimes it broke apart. Sometimes pieces remained. Sometimes the jaw itself was damaged. And remember, infection was always waiting. Number 7. Bloodletting. For centuries, many doctors believed Illness happened is the body contained too much blood. So naturally, the solution was to remove it. You got headache, bloodletting, fever, bloodletting, pneumonia, bloodletting, stomach pain, bloodletting. Cuts or leeches were used to drain blood. Occasionally, some people did improve. Often, they would have improved anyway. Others were simply weakened even further. Yet the practice continued for centuries. Because when medicine doesn't understand the real cause, even bad ideas can survive for a very long time. Number 8. Broken bones. Breaking a bone is painful enough. Now imagine there is no x-ray. The doctors can't even see what's wrong. All he can do is feel. Then he grabs your arm or your leg and pulls hard. The goal was to force the bones back into alignment. Sometimes it worked beautifully. Ancient physicians became remarkably skilled at setting fractures. Other times, the bone healed but remained crooked forever. Even a successful treatment meant weeks or months, hoping nothing became infected. Number 9. Childhood births. Now imagine you're about to become a mother. Today, childhood birth is still serious, but doctors have antibiotics, blood transfusions, emergency C-sections, and centuries of medical knowledge. Ancient mothers had none of that. If labor became difficult, there was often very little anyone could do. A baby stopped during delivery could become a death sentence for both the mother and the child. Even after a successful birth, the danger wasn't over. Heavy bleeding could kill within hours. Infection could kill days later. What should have been one of the happiest days of your life was often one of the most dangerous. For countless families, it ended in tragedy. And now here's the terrifying part. The pain wasn't always the biggest danger. The real enemy was invisible. Bacteria. Ancient doctors had no idea that germs actually existed. They couldn't fight something they didn't know was there. A successful operation could still end in tragedy. Days later, the wound might become swollen, then fever, then infection, and there was almost nothing anyone could do. Today, a short course of antibiotics can save millions. Back then, people simply hoped their body won the fight. So, modern hospitals aren't perfect. Nobody enjoys having surgery. Nobody looks forward to visiting the dentist. But compared to ancient medicine, we live in the luckiest era in the entire human history. Because if you needed a surgeon 2,000 years ago, your greatest fear wasn't a disease. It was wondering whether you would survive the cure. The disease might give you a chance. The treatment might not. Because when the doctor finally says, "I can help," that wasn't always good news back in the day.